Good evening. Good evening. Okay. In today's class, we will discuss about the chapter called traction. Okay. We will discuss about the chapter called traction. So, any idea about traction? So, have you anyone heard about the term called traction? So, what in the sense? Okay. So, traction what he is saying, there will be a space between the joints. Okay. So, any other thing? Yes. Before every exercise, you have to do traction. Okay. Any other? Okay. So, initially, traction is nothing but it's a elongation of the area where we apply the traction. Okay, elongation of the area where we apply the traction. Okay, so this traction is further divided into manual traction, mechanical traction. Okay, this traction is further divided into manual traction, mechanical traction. So in manual traction, so when are all this manual traction needed for the person? Any idea? Manual traction. No idea. Okay, in a case. One person faces a road traffic accident. Okay, faces a road traffic accident. So in that road traffic accident, he was affected by the fracture of the femur. Okay, he was affected by the fracture of the femur, especially the shaft of the femur is got fractured. Okay, so that in that fracture also it is a displaced fracture. Displaced fracture means the bony fragment, assume that it is the shaft of the femur, the bony fragment is being came out. It is a displaced. If it was in the same place means it is an undisplaced. So in displacement it will, there is a gap between the shaft of the femur. That means fracture site. Okay. So what will be the management for this case? Is it we can manage it in a conservative way, or surely the patient will need for a surgical management? So surely the patient will go for the surgical management because of the displaced fracture. Okay. So the road traffic accident occurs. The patient was carried out to the nearby hospital. Okay. So patient was carried out to the nearby multi-specialty hospital. So in that after following the X-rays and other investigations, the patient was diagnosed as the shaft of the femur fracture with a displaced fracture. So orthopedic surgeon suddenly they will fix the patient for the surgical or not? Yes or no? Surgical operation no, because they want to go for the blood investigation, and also they will see for the whether the patient is fit for the surgery. So for that procedure it will take around 1 or 2 days. Okay. So in that 1 or 2 days, what are all the patient may be go for? The displaced fracture may be go like this. So concept is the displaced fracture should be united in the same position. So if the displaced fracture is go up and down like this, means what will happen to the limb length? Whether the limb length will be the same level or the affected level will be go for the decreased limb length. Then it will create lot of biomechanical disadvantage in our body. Yes or no? So for that, till the surgical procedure is going to happen, the orthopedic surgeon will advise the patient to physiotherapy department for applying the manual traction. So in that, there is a kit called manual traction kit. In that kit, there will be a bandage application where we can apply the bandage over the thigh region, and the distal segment will be like an elastic segment. In that we can apply the weight over that distal segment. So it will maintain the joint position. So assume something is pulling the, so patient is supine in position. In the end of the couch, we are applying the manual traction kit, and also we are putting the weight in the manual traction kit. So the shaft of femur will be like this. If we are applying the weight, so it will be in the same position. Yes or no? It will be in the same position because of the weight. It won't be merged like a up or downwards direction. Yes or no? So that procedure is called as the manual traction. So next one is the mechanical traction is for disc compression. Okay, so disc compression, disc belts, nerve root compression, spinal belts. So for that we will use the mechanical equipment called traction. So depends upon the cervical area or lumbar area, the parameters will change. Okay, is it clear about the traction? Any doubt? Okay, thank you.